Hi, everyone. Welcome to another Women in Surgery highlight video. My name is Anna Jones, and I'm an MS3 pursuing OBGYN. Today, I have the pleasure of speaking with Dr. Haller Smith, an assistant professor in the Department of Gynecology Oncology. Dr. Smith, can you tell us a little bit about yourself?
Sure. Like Anna said, my name is Haller Smith, and I grew up in a small town in Southwest Alabama called Monroeville, and then have essentially done all of my medical training at UAB. So I came here for medical school and then have stayed for residency, fellowship, and now am on faculty here. And so I finished fellowship in 2019, so have been a gynec faculty here at UAB for almost 3 years now. And yeah, that's how.
Can you describe your journey towards pursuing OBGYN and then choosing to do a gynecology oncology fellowship?
Sure. So I will say that of all the things I thought I would do when I came to medical school, OBGYN was really not high at all on the list. So as a college student, I did a lot of shadowing of a general surgeon in my hometown, and then actually spent a lot of time with the surgical oncologist here at UAB, and have always sort of just been interested in cancer care. And so I initially thought I wanted to do some sort of medical oncology, and then fell in love with the operating room, and so thought I was going to be a surgical oncologist. And I have an uncle who is a primary care physician who actually did OB early in his medical career, and was doing OB in a small rural community where he was on call all the time. And so I grew up hearing him say, whatever you do, if you become a doctor, like, don't be an OBGYN. And so it just was something that never crossed my mind. And then I went to medical school here. I did my clerkships in Birmingham, and OBGYN was my first clinical rotation. And the way that the clerkship is divided, as most of you know, we do 4 weeks of OB and 4 weeks of GYN. And so I actually started on obstetrics and actually loved it, and was very surprised by that. And then went to benign gynecology, and then ended on my 2 weeks of gyn-onc, and just felt like sort of everything fell into place at that point. So I loved the surgeries. I loved the patients. I felt like it was a patient population that I really connected with well. I liked that I still, got to do the chemotherapy and really take care of them throughout their cancer journey. And so, essentially, as soon as I finished that clerkship, had decided that I was going to go into OBGYN, and had a good idea that I was going to become a GYN oncologist.
So I think that there's quite a few medical students that faces the decision of either pursuing OBGYN versus general surgery, especially those who enjoy gynecology oncology. Do you have any advice regarding that decision and how to make it?
Yeah, I mean, I think, I think it's very understandable. I was sort of the same way. I loved surgery, and then ended up loving my gyn-onc rotation. I think, one thing that I would say to people who are having a hard time deciding is that, in order to become a GYN oncologist, you have to do an OBGYN residency and, be an OBGYN. And so if you really dislike obstetrics, then I think, the way our residency program is structured, you do one gyn-onc rotation per year. And that's actually more than what you do at a lot of other programs. And so if you don't think that you'll be happy or enjoy doing any OB, then it's going to be a very long 4 years. And you just never know what will happen. And so I would say if OB is kind of a deal breaker, then probably gyn-onc is not the best choice, and maybe go more towards general surgery. But I actually loved OB. I loved benign gynecology. And so I loved residency. It's just gyn-onc was always sort of where my heart was in terms of the patient populations and what I felt like I would enjoy the most.
Okay. Have you had any challenges as a woman in a surgical field? And if so, how have you overcome them?
I think the main challenge, which I think we may get to a little bit later, is really just how to manage like family and work, and, trying to do that all well. But, I think in terms of like other challenges related to work, I think, OBGYN is a very female heavy field. And I've been very fortunate to have a lot of strong women as role models. And so, I think in terms of like how to, be assertive at work, or, be respected in the operating room and those things, I have not had any of those challenges.
Gotcha. Kind of going off of what you said, how do you balance both your professional life and your personal life?
So I think no matter what field of medicine you go into, that's always a challenge. And I think for surgery of any kind, it's maybe a little bit bigger challenge, just because it is a fairly inflexible job. And, if you have 5 procedures scheduled in a day, and your child gets sick, like it's difficult to just cancel all of those surgeries and go home. And so I think it is always a challenge. And, it's funny, I sort of have thought of this a lot, and I think it's a little bit less of like a work-life balance as it is more of a juggling act, and trying to see, how many balls you can successfully keep in the air at the same time. And so, I think some people are better at it than others, right? Some people can juggle lots of balls, whereas some people, maybe can get 2 or 3 and then they start falling and hitting them in the face. But I think like just being careful about where you choose to spend your time, and understanding that there really is no way to do it all. And so there's some days that I spend more time at work and less time with my kids than I want to, but then there are other days that work is less busy and I leave early and go home and spend time with my family. And so I think you just have to learn to give yourself a little bit of grace. And, I hope my kids are young, they're 4 and almost 2. But I think my daughter already talks about how she is like proud that I'm going to help people and make them feel better. And so I hope that, I'm being a good role model for her, and that, one day she's going to appreciate this. And, I also think like my job makes me really happy. It's like very fulfilling. I love what I do. And so I think, I just learning that sometimes something has to give a little bit, and you just like when you give a little bit less of yourself one day, the next day, you can do better at the other thing. So.
Awesome. What advice would you give to female medical students when exploring a surgical specialty?
I think just like, and no matter what specialty you choose, I think you spend a lot of time at work. And so I think you have to choose the thing that you're most excited to get up and do in the morning. So find a clerkship that makes you happy, that, going in early doesn't feel like such a chore, and that you can really connect with those patients and see yourself, doing this for the rest of your life. So I think, we all give a lot of ourselves at work, and that's something that comes with the job. So I think you just want to make sure that whatever you're doing, like, is something that you get joy and fulfillment out of. And so, find the thing that makes you happy and excited, and then whatever the challenges are, related to family or outside interest or whatever else, I think all of that will work itself out.
Okay. And then to kind of go different direction for our last question, can you tell us about what you love to do outside of your professional life?
So, mostly outside of work, at this point, I just spend time with my family, but I love live music. And so, have not been to as many concerts as I used to go to since COVID happened, but I think that's one thing. And then my husband and I both really enjoy the food scene in Birmingham and eating out. And so nothing exciting. I don't actually really think I have anything that would be considered a hobby, but those are the things that I tend to do in my free time when I'm not chasing my kids around.
Well, awesome. Thank you so much for taking time out of your busy schedule and being able to talk to us, and just giving awesome wisdom. I really appreciate you and everything that you've done for me, and also everything that you're doing for everyone around you. So
Oh,
thank
of course.
you.
All right, good luck.